Dear friends, welcome to Time with Thebsian. In this episode, I will be talking to you about normal saline. You know that whenever hospitalization is there, the first thing the hospital people are going to do is to provide you with a bottle of saline. Saline is 0.9% sodium chloride solution, and this is used alone, or if the medical people want to add some medicine to you through your IV, that medicine is injected into the bottle or the bag. Normal saline belongs to the drugs called crystalloid. It is not very uncommon that as soon as saline is started, the patient may get some side effect. And these side effects may be of different, like fast heartbeat, fever, red rashes around the skin, joint pain, and shortness of breath, etc., etc. In this case, the bystander or the patient has to inform the medical people so that they will come and observe the patient and do the needful. Whenever such things happen, they come and stop the supply of saline. Then the doctor will come and examine the patient, whether he is having fever and made swelling in the tissue, and whether the bottle is of good standing. Solid pieces in the bag to show that growth of bacteria or algae, because saline doesn't contain no antibacterial agent. Therefore, the medical people will check the water thoroughly and they will decide how to treat the patient. And saline solution gives the input of water and electrolytes. 0.9% sodium chloride solution is the saline, and this saline is used for hemodialysis too. And one can see that different types of flexible containers are available in the market. They are non-latex, plastic, transparent material, usually made up of polyvinyl chloride. Safety of these containers are assured by insisting that they should pass the class 6 test under USP, because class 6 describes various tests for plastic containers that have to be declared biocompatible and safe. This flexible container is a closed system with adequate quantity of air inside so that the flow of the saline into the patient will not be hindered. Further, these saline bags come after sterilization. And you can observe these containers have two ports. One is the outlet port, and second one is a second port for the doctors to use to administer any other medicine. These containers are tested for safety by USP Class 6 test, but the saline within the plastic saline bags are tested for pyrogen, because whenever the patient gets a fever or rashes or a breathlessness, that may be due to the contamination of the saline with pyrogens. For pyrogen testing, routine testing is carried out using rabbits. Pyrogens are substances that can produce fever. Most common pyrogens are endotoxin. Usually, after manufacture, a saline bottle is safe for use up to 28 days. The FDA has accepted some other tests to replace rabbit pyrogen test. These tests are considered alternative methods such as LAL test, monocyte activation test, on a case-by-case basis, depending upon the decision of the manufacturer, and duly informed to FDA and receive the approval. Whether these saline solutions may contain leaching materials from the bag. That is a big question asked by many of the consumers, and the answer is yes, there will be some leachants coming into the stored solution of saline. Different companies suggest or certify what are the leachants from their bag and the time taken for leaching, therefore assuring the customer that these bags do not leach large amount of organic chemical contaminant. And dear friends, we are coming to the end of the session on saline bags. It is to be remembered that whenever you are in the hospital or as a bystander or a visit to your relative who is admitted, it will be very pertinent to look for details in the saline bags which is being administered to the patient, and observe the nature of the patient as the saline is started, whether he is having congestion, breathlessness, rashes on the body, convulsion, or like that. Because hospital, the doctor prescribes and the nurses will connect, and as soon as the drip starts, and they will count how many drops of drip is going in 1 minute, 2 times, and then they will leave the place. When adequate quantity of the saline is within the body, then only the patient's response to the saline, which is a foreign chemical within the body, will respond. So you have to be very careful. And definitely you have to note the manufacturing date, the expiry, and the company name and the time in which it was started administration. So this is for the consumer point of view. We have history of patient death just due to the administration of contaminated saline from the saline container. So be careful and be watchful. That is why this Time with Thebsian program is on. It is consumer safety is the basic factor behind all my presentations. Thank you very much for being with me, and I hope we will meet next Friday. And kindly, after watching my program, you express your likeness and share my program with your friends. Thank you very much. See you next week.